This video is from a teaching session that I did to third-year vet students. It was an introduction to equine osteopathy, and we used this horse as a model. She's a 19-year-old Shagya Arabian mare that has worked most of her active life as an athletic carriage driving horse, and she has also competed in endurance and elementary level dressage. She's now retired, and from her history we know that she's had a few issues with the joints of her right distal forelimb. So the first thing we did is we started with observation of the horse from all sides, because this gives us a lot of information, like her hollowed back, the fact that she likes to have her right forelimb tucked under her body. And then watching her from behind, we can see some pelvic asymmetry as well as external rotation of the hind limbs, which could be an indication for sacroiliac or pelvic dysfunction. And then on the right side, we notice the atrophy of the muscles on the right shoulder, as well as hypertrophy of the ventral neck muscles on the right side, which is consistent with the issues that she's had on the right forelimb. And we can see these signs again from the front, the atrophy of the shoulder. And in addition, we can see that she's standing with her forelimbs quite wide apart, trying to offload the right forelimb and redistribute her weight. Next, we will move on to gait analysis to identify abnormalities in movement and to try to associate these with specific anatomical areas. So on this horse, we only did the walk because it's retired old horse, arthritic, and we didn't want to cause any unnecessary pain, and because it's quite slow pace and it's easier for the students to identify any abnormalities. So moving from front to back, we can see that the horse lifts its head each time the right forelimb takes a stride. The right forelimb takes a shorter and quicker stride because it's obviously painful and the horse is lame. Then moving at the back, we can see a rather stiff back at the level of the thoracic spine, which is compensated by more movement at the level of the lumbar spine and the pelvis. And this affects the hind limbs as well. And we can see that the left hind limb takes shorter strides. And this is probably a compensation pattern because it's the diagonal of the right forelimb. And then we moved on to examination to let the students feel for themselves the passive movement of the joints, and a demonstration of some of the techniques we use in osteopathy. Here we see an articulation of the fetlock and the sesamoids and the coffin joint here. We found that there was a restriction in external rotation and tried to fix that. And then we incorporate some stretching, improve any restrictions coming from the soft tissues. And then we repeat the stretching on the other side to keep the horse balanced. And then we move on to demonstrate some soft tissue techniques. Here we are trying to break adhesions and separate the fibers of the ventral muscles of the neck, and at the same time increase the blood supply to make them more supple. And this will help the horse relax the neck and the back. Now we move on to the pelvis, and here I'm articulating the sacroiliac joint, and here I am checking active flexion extension of the spine, and then we'll go back to gait analysis to see if we have made a change. So again, at the walk after treatment, we see that the head and neck is much more relaxed in a lower position, moving more freely at the walk. The back looks more supple, and the spine is moving. The right shoulder looks more free, and the right forelimb takes longer steps, and they're not as hurried as in the first video before the treatment. Actually, both shoulders look better. Of course, we cannot treat arthritis and the wear and tear of the joints that has already happened in her life, but we can influence the perception of pain and the pain signals that reach her spinal cord and her brain. We can also see a better movement of her lumbar spine and the pelvis, but to improve it even more, this would normally need a follow-up session in about 3 to 4 weeks. But anyway, this was just a demonstration session, and it was not a full, proper treatment. But still, I think we have made a difference for this horse, and we managed to make her a little bit more comfortable.